On a Monday morning, the road outside Children's is busy. Inside its gender diversity department, it's likely anything but.
If you are calling to express concerns for this suspension of care, press 1.
On Friday, Children's Hospital Colorado announced due to a federal investigation, it would stop providing gender-affirming care for patients under 18. Denver Health did the same after reviewing, quote, many of the escalating actions of the U.S. Department of Health and Human Services.
That is putting real danger on individuals' right to privacy around medical access.
Jax Gonzalez is the political director at One Colorado, an LGBTQ advocacy group. They're connecting with families as they navigate the abrupt stoppage of care. They're also looking to fight some of these federal actions with legislation of their own.
That is centered on making sure our most marginalized have access to the resources they need.
So it has sent a lot of shockwaves through that community.
Paula Greisen is a civil rights attorney. She believes what these hospitals are doing is discriminatory.
Do you think these families and these patients have a case?
I absolutely do. Colorado law prohibits discrimination based on gender and gender identity. And by stopping care, medically necessary care, for a certain group of patients, that's discrimination.
While things move on a federal level, Children's Hospital says not all of their care has stalled. They are still providing therapy for these minors, something advocates fear more may need.
Mental health care services will need to increase in the next year and continue as long as we disallow young people to access care that is life-saving.
Children's Hospital Colorado responded to that claim of discrimination in a statement saying all families, including those of gender-diverse children, should still be able to access expert care. Denver Health reshared last week's statement saying they're working to support families.
I mean, I know that you spoke to the woman there that was representing the narrative about the national pressure, but I can only imagine what some of these minors are feeling.
Yeah, the big concern right now is not only the medical aspect of it, right? The physical health of an abrupt stoppage that obviously has its ripple effects and side effects, but the mental health for these individuals and these children, that's a major concern for a lot of the advocates in this world. And it's important to point out that gender-affirming care for minors is still legal in Colorado. These hospitals are just stopping care because of federal pressures.
That's interesting to see them. I mean, I don't want to use the word fold, but essentially do what President Trump asked of them.
That is what they were looking to do. So yeah.
All right, Julissa, thank you.